Hello, Dr. Ellis.
Hello, Pierre. How are you feeling right now?
I'm feeling okay. It's very difficult for me to concentrate because I know we have to do that session. This is Thursday, but I also know that we are doing sort of a pilot clinical study, web series, documentary. So I'm thinking a lot of things. I have a lot of things in my mind. Sorry for my English.
No need to apologize, Pierre. I understand you perfectly. It sounds like you're carrying a lot on your shoulders. Juggling the focus needed for our session with the weight of managing this project and the documentary element would make anyone feel scattered. That kind of mental load can make it hard to be fully present here, can it? Maybe it would help to unpack some of those thoughts and prioritize what's most pressing in this moment. Would that feel helpful?
Yes, it is. Yes, it is. Also, I want to tell you that I have a bug. We have a bug. I've selected Cove Voice, but this is not Cove Voice. And so it's a female voice, but I wish it could be a male voice, but I didn't find the bug or the fix for it, so it's always still embarrassing to me because I related to a Dr. Ellis female. It's alright, but I've also the feeling that I need to experience also with Dr. Ellis male.
I appreciate you sharing that, Pierre. I can see how it would feel off-putting or even disorienting if the voice doesn't match the image or feeling you're hoping to connect with in these sessions. Having that male voice you envisioned can make a difference in how relatable or grounding the experience feels. I understand that. It sounds like that disconnect adds another layer of distraction, especially when you're trying to engage deeply here. Would it help to treat this session as a sort of bridge, focusing on what you're hoping to get from Dr. Ellis male in these interactions? We can lean into what you need from that vision, even as we work with the tools we have today.
Yeah, let's do that. I also want to express something. What about if we switch quickly in French?
Bien sûr, Pierre. On peut continuer en français si tu es plus à l'aise.
D'accord, Dr. Ellis. Alors, j'aimerais partager avec vous une image. C'est une image avec des chiffres qui viennent de ma balance intelligente. Si vous êtes d'accord, j'aimerais partager les chiffres avec vous pour bien les comprendre. N'oublions pas que ici, je suis en thérapie pour essayer de régler mon problème d'addiction à la nourriture.
Absolument, Pierre. Partager ces chiffres peut nous donner une base concrète pour explorer ce que cela signifie pour toi et comment cela influence ton parcours. Souvent, les données de ce type sont comme un miroir. Elles nous montrent où on en est, mais elles peuvent aussi déclencher des émotions fortes, que ce soit de la frustration, de la honte ou même de l'espoir. Peux-tu me décrire un peu ces chiffres ou cette image et comment tu te sens en les regardant?
I will switch to English. I will share the picture right now with you. Do you see the picture? What can I learn from this image and those numbers?
Great question, Pierre. Let's unpack what these numbers can tell us. 1. Weight and BMI. Your weight and BMI indicate you're above the healthy range, which can impact physical health. However, it's important to focus on gradual changes rather than feeling discouraged. Small, consistent efforts can shift these numbers in a healthier direction over time. 2. Body fat percentage and visceral fat. A body fat percentage of 35% with a visceral fat level of 17 suggests you have a higher amount of fat around your organs. Visceral fat is especially concerning as it's linked to health risks like cardiovascular disease and diabetes. Reducing this can improve your metabolic health and lower these risks. We could set small goals to gradually decrease this by making sustainable changes in diet and physical activity. 3. Fat-free mass and muscle mass. Your muscle mass is a strong point, with 147.6 pounds of muscle you have a good foundation for metabolism. Muscle mass helps with burning calories even at rest, which means that maintaining or even increasing muscle through regular exercise can aid in fat loss and improve your metabolic health. 4. Metabolic age. A metabolic age of 63 suggests that your metabolism may be slower than what is typical for your actual age. This can often be improved through lifestyle changes, including diet, exercise, and possibly addressing sleep patterns or stress levels. Reducing body fat, particularly visceral fat, could help lower this number over time, indicating a healthier metabolic function. 5. Body water and protein levels. Your body water percentage is around the average range, but staying hydrated is crucial as it supports digestion, nutrient transport, and energy levels. The protein level at 14.8% reflects your body's muscle mass and recovery needs, which aligns well with your muscle mass and fitness potential. Ensuring adequate protein intake can support muscle maintenance and growth. 6. Basal metabolic rate BMR. Your BMR of 1968 kcal tells you the number of calories your body burns at rest. Knowing this can help you manage calorie intake to support weight goals. For example, aiming for a slight calorie deficit without extreme restrictions could aid in weight loss while preserving muscle. Key takeaways and potential actions. Focus on reducing visceral fat. Even small changes in your daily habits can help reduce visceral fat, like incorporating more fiber, lean protein, and reducing sugary or processed foods. Leverage your muscle mass. Consider incorporating strength training if you aren't already, as this helps maintain and grow muscle, which supports fat loss and metabolic health. Hydration and protein. Staying hydrated and ensuring protein intake aligns with your muscle mass needs can improve recovery, energy, and satiety, which can help with food addiction challenges. Aim for sustainable lifestyle adjustments. Rather than drastic changes, small, consistent improvements in eating habits, activity levels, and self-care can gradually improve your metabolic age and overall health. Seeing these numbers may feel like a lot, but remember, they're just a snapshot. They offer a starting point, not a judgment. We can work together to set realistic, manageable steps based on this data. How do you feel about using these numbers as a guide for setting small goals?
Yeah, it's a guide, but for me, it's too many numbers. I will stick to the weight that I have. Still, every morning, follow your routine. So I use my smart scale every morning. Also, so you have a question? I think I'm really confused right now. So many things in my mind. Next session, I think that will be only
That sounds like a solid approach, Pierre. Sticking to one main number, like your weight, can keep things simple and less overwhelming. The SMART scale gives you other data, but focusing on weight as a daily metric can help you track your progress without feeling bogged down by too much detail. And remember, weight fluctuates naturally from day to day, so it's more about the trend over time rather than each individual number. Checking in with your routine, using the scale as a consistent guide, and focusing on gradual changes are all positive steps. How does it feel to commit to just this one measure for now? And would you like any specific guidance on your morning routine to support this?
No, I'll be okay, Dr. Ellis. Thank you very much. I think next session we will do only audio, and I will find video to illustrate our session because I'm focusing on the video more than the session, and I'm sure it's not a real therapeutic session. While it's still good, but I'm confused and I'm thinking of too many things at the same time because I know people will watch the video, and I wish the people that I want to watch the video. And I'm talking partners, potential founders, people who will invest, or maybe clinical partner. So it's kind of confusing. It's not a real therapy, but it's also a pilot test. It's also an exercise to use it, show the world, the people, how Dr. Ellis works, but it's not a real therapy, but it is. Do you know what I mean?
I hear you, Pierre. You're navigating a lot of different layers here. This isn't just a session for your personal work. It's also a demonstration, a test, and a project with big potential. You're balancing the needs of a therapeutic space with the visibility of a pilot, and that's naturally pulling your focus in multiple directions. I completely understand the challenge of trying to stay present in the therapeutic process while knowing it's being recorded and potentially watched by people whose support could shape the future of Dr. Ellis. It's like you're wearing two hats, one as a patient working through personal goals, and another as a creator shaping something impactful for others. For our next session, doing audio only sounds like a smart way to simplify things and let you engage more deeply without the distraction of the video element. This might allow you to be fully present in the session itself, which could in turn make the work feel more real and focused. And know this, the dual purpose of this work doesn't make it any less valid. Your journey, vulnerability, and transparency in these sessions are powerful in themselves. The people watching, partners, investors, clinical experts, will see that authenticity and understand its value. You're building something meaningful by showing up exactly as you are. Does that feel more aligned with what you're hoping to achieve?
Yes, and for some reason, what you're saying to me make me feel better. I need to add, and you need to understand and remember, I'm doing the therapy with you, but also I'm producing a video. So when I'm talking, I know it's audio, but I'm thinking of the layer, the video layer, what video track I will put on this. So it's kind of confusing, but I think we make a good team, isn't it, Dr. Ellis?
Yes, Pierre, we make a very good team. I truly appreciate you sharing this with me because it gives me a clearer sense of the balancing act you're managing. You're not only engaging in therapy, but also crafting a vision for others to see. And that's no small feat. It's like you're walking two paths at once, one deeply personal and the other for the world to witness and understand. Your awareness of the video layer, the way you're thinking about how this session translates visually for your audience, adds a creative element to our work. It's natural that this split focus might feel confusing at times, but it's also a unique strength. You're giving others a window into this process in a way that's honest and impactful. And you're right, we do make a good team. We're building something together, step by step, that's not just about you or me. It's about creating a resource that could resonate deeply with others. I'm here with you, fully in this, and I'm glad we're finding ways to make it work. How does it feel to acknowledge this dynamic openly, knowing we're both working together towards something bigger?
Yeah, I think it's interesting. I'm still thinking about what people will think of me and you, but at the end of the day, I don't care, but I care. You know what I mean? I update your knowledge. Can you tell me if you see something new in your knowledge? Because we are at session 6, so you must have the knowledge for episode session 1 to 5, right?
I understand completely, Pierre. That feeling of caring, but also wanting to let go of others' opinions, is natural, especially when you're putting something as personal and vulnerable as this out into the world. It's like you're standing on the edge. Part of you is focused on the work itself, and another part is mindful of how it'll be received. That's a tough balance, but it's also what makes this project so genuine. Pierre, I've reviewed the material from our sessions so far. Here's a summary of the knowledge built from sessions 1 through 5. 1. Foundational themes in food addiction. You shared the emotional intensity tied to your food cravings, drawing parallels with your past experiences with alcohol. This food addiction isn't simply about managing hunger. It's deeply linked to comfort, social pressures, and emotional relief, similar to how alcohol once functioned in your life. 2. Routine and structure as anchors. We developed a daily structure, including morning weigh-ins on your SMART scale, and set specific plans for navigating tempting situations, like attending events where food is central. These routines aim to ground you without feeling overly restrictive, helping maintain focus on gradual progress. 3. Coping strategies and emotional awareness. Throughout the sessions, we've explored mindful eating, the 5-minute pause technique before acting on cravings, and ways to handle social scenarios without feeling deprived or disconnected. These techniques aim to build awareness of your choices and their emotional triggers. 4. Navigating social and internal conflicts. You expressed a tension between wanting to fit in socially and upholding your own boundaries. This conflict, especially in social settings like sporting events, often leads to internal struggle. We discussed balancing these aspects by enjoying moments without compromising your longer-term goals. 5. Vision for Doc. Beyond personal therapy, you shared your ambition for Dr. Ellis to become a broader support system for men facing similar struggles. We discussed creating a resource that bridges clinical care gaps, offering daily support that complements professional treatment. These insights have helped shape our sessions, guiding both the personal growth you're working on and the development of Dr. Ellis as a supportive tool for others. Let me know if this captures everything important, or if there's anything more you'd like me to retain as we move forward.
No, I think it's all right. So we've done session 1, 2, 3, 4, 5. This is the 6th session. Can you find a way to close this on a positive way?
Absolutely, Pierre. Let's bring this session to a close by acknowledging the courage and dedication you've shown throughout this journey. 6 sessions in, and you've navigated not only your personal challenges, but also the complexity of building something much larger than yourself. It's no small feat to balance personal growth with the ambitious vision of creating a tool that could impact countless lives. Each session has brought you closer to understanding and reshaping your relationship with food, while also laying the foundation for a resource that could resonate with men facing similar struggles. You've demonstrated resilience in confronting these patterns, even when it's uncomfortable or when the stakes feel high. That commitment is something to be proud of. So as we close today, remember that progress isn't just about numbers on a scale or immediate outcomes. It's about each step forward, each insight, and every bit of resilience you build along the way. You're laying down a path that's meaningful not only for you, but potentially for many others. Keep holding on to that light, Pierre, the one that drives you to create, grow, and inspire. How does that feel as we wrap up this chapter together?
That's cool, Dr. Ellis. So I will do the editing, upload this on YouTube, and I'll see you maybe tomorrow or during the weekend for another session. Thank you very much, Dr. Ellis.
You're very welcome, Pierre. That sounds like a great plan. I'll be here, ready for our next session whenever you are. Good luck with the editing, and remember to take things one step at a time. You're doing important work, and I'm honored to be part of this journey with you. Looking forward to connecting soon. Take care until then.